Member for Prince George Valemount.
Well, thank you very much. And the conversation is not about the job that actually nurses and physicians and radiologists and all of the healthcare professionals are doing. They're doing a fantastic job. This is all about the job that this minister isn't doing.
Exactly.
So let's be clear, the minister is relying on bringing in private company nurses at a salary range that is up to 3 times more than the pay of their colleagues. So the minister can dismiss that, but what it is doing, it is driving nurses out of public health care to go to a private contractor so they can come back to work in the very same unit for up to 3 times more money. And the minister simply dismisses it. Here's what a nurse from Vancouver told us. I'm expected to show up every day and work in a toxic workplace for an employer that doesn't respect me. To add insult to injury, I'm now working side by side with agency nurses who are doing the same job that I am for nearly twice the pay that I earn. And they are former colleagues that I've worked with in the same unit for over 10 years. And
good job. Good job.
And the minister can smile and ignore all of these details. It is demoralizing to nurses. He is relying on privately contracted nurses to prop up the healthcare system. It is time he did the right thing, stood up and resigned.
Yeah.
Minister of Health.
Well, thank you, Honourable Speaker, and for members of the opposition to talk about privatization, Honourable Speaker. For the leader, well, Honourable Speaker, the authors of the largest layoff of women workers in the history of North America, Honourable Speaker, there they are, Honourable Speaker.
Members, yesterday we had a wonderful question period, very dignified, very respectful. Let's try to maintain the same spirit, please. Thank you, Minister of Health.
I don't know what's changed, Honourable Speaker. I don't know what's changed. Honourable Speaker, what we focused on is adding nursing positions, adding nurses. When I became Minister of Health, we were last in Canada in nurse practitioners. We were 10th in Canada in registered nurses. We had fewer nurses, believe it or not, registered nurses in 2016 than we had in 2009 when the Leader of the Opposition became Minister of Health. We are dealing in a period of pandemic and, of course, responding with urgent measures where they're required to ensure people get the care they're required. And that is my responsibility as Minister of Health, and you bet I'm carrying it out.
Prince George Valemount, supplemental.
Well, thanks very much. And the part of the answer that the minister ignored was that under our government, we had the best health outcomes in the country, bar none. And in fact, he can go look it up because he's well familiar with High, and that is exactly who made that, looked at outcomes. So let's be clear. This minister today hasn't denied the use of privately contracted nurses. In fact, he's celebrating the fact that he is using privately contracted nurses at up to 3 times more the salary than nurses that are working in the public healthcare system. And apparently that's acceptable to the minister. Well, it isn't to the BC Nurses Union. And here's what the president said. President Amin Grewal said, it's a bit of robbing Peter to pay Paul type of situation because they're leaving one employment to go to do an agency nursing. We're still at a loss, end quote. The minister has created such a mess in the healthcare system. It has collapsed. It has come to the fact that he has to hire contracted nurses so that British Columbians can get some semblance of care. This is not about nurses. This is not about doctors. This is about a minister who has failed in his portfolio, who has created a mess, and it is time for him to accept that and step aside.
Minister of Health.
Well, thank you very much, Honourable Speaker. As members will know, if you're waiting to get surgery, we were around the bottom of the country when I became Minister of Health. And now, in many categories of hip and knee replacement surgery, we're number one. Where we did, well, Honourable Speaker, we count these things. And the leader of the opposition, the leader of the opposition, Honourable Speaker, talks about Ki-High data. That's Ki-High data, Honourable Speaker. That's Ki-High data, and it demonstrates that. When you were waiting in Northern Health to get diagnostic care, Honourable Speaker, and we've added and more than doubled the capacity, for example, for MRIs in the Northern Health Authority. We were waiting, and now we're waiting dramatically less time there and across British Columbia. With respect to nurses, the opposition says 18% more in the bargaining unit is not good enough. I agree. And that's why we're adding nursing spaces, Honourable Speaker. We're adding internationally educated nurses. We're addressing the situation that we face in front of us, ensure that people get the care now and get care in the future, Honourable Speaker. That's what we're going to continue to do, which is strong action to respond to the challenges facing a healthcare system that's dealing with two public health emergencies and healthcare workers and healthcare professionals who are doing an outstanding job.